How did you end up being treated by Dr. Utley?
Well, I hurt myself at my job. It was a warehouse job. Um, Ended up having two herniated discs. So I knew Dr. Utley through childhood, and we kept in contact with each other. And I know he was a chiropractor, and just called him up and went to his office and got treated. I thought his procedures were good. You know, he explained to me everything. As soon as I walked through his office, we explored all my options. But he told me that through my diagnosis through X-rays, that I had two herniated discs in my back. Um, when treatment started, the first thing I do when I get to the office was I lay down on a waterbed, and it's like a massage, I guess, to loosen up my spine to get ready for treatment. But yeah, the procedures were pretty good. And after the treatment in the waterbed, he would take me to his office, and that's when he does his adjustments. Yes, he did explain to me the importance of having regular treatment. Um, he said without it, of course, my back could get worse. Of course, I don't want that. Um, but I went in for my regular treatments, and pretty much he told me with my condition that it would be about a year before I would be able, well, my back would be normal again. So yeah, he explained it. Also that our spinal cords are pretty much like shock absorbers, and without it, it'll just take everything out of proportion. You'll be really seriously injured without your back being treated. Um, Surgery on my back. Well, any surgery is scary surgery for me. Talking with the warehouse's doctor, he wanted to do the surgery. He explained to me the procedure of that surgery, so that's why it took me a long time to think about it, because it's my back. It's just pretty much your whole livelihood. So I was very concerned about that, but I wanted to do some research and see what the possibilities and or any bad things that happen with people having a surgery done to their back. So I was real scared. Um, his take on surgeries is only do it if it's real necessary. If you can avoid surgery at all costs, do it. Um, because sometimes people who do have the surgery end up being worse than when they are, before they had the surgery. Um, and I did see that when I was doing some research, that people really end up worse after having that surgery done. So after talking with Dr. Utley, he really made it plain and simple. Don't do the surgery. He said he was able to get me back to normal without surgery. It'll take some time, but it'll be worth it. You'll be better off with adjustments and treatment than going under the knife. Well, they say on the scale of 1 to 10, 10 being the worst, my level of pain was a 20. I mean, it was bad. I couldn't walk really. I pretty much stayed in bed. I was pretty much bedridden. Only time I got out of bed was to, fix myself something to eat or use the restroom. But it was that bad. I walked awkwardly to suppress the pain, but it was horrible. I couldn't. I won't put that on my worst enemy. You know, it was pretty bad. Getting around, it was a struggle. To get up and out of that bed, or even go out to do my treatments with Dr. Utley, it was pretty bad. And you know, Dr. Utley also informed me that without treatment or even going back to the surgery, when you come out worse, people have actually committed suicide because of the pain. And I can really believe it, because that's how much pain I was in. It was just so unbearable that I really wanted to go away. But, you know, I just toughed it out, and with the help of medicine, kind of suppressed the pain. And, yeah, but to get around, it was a struggle, especially going up and down stairs, and sitting in the car. It was just horrible. But I dealt with it, and it came out fine in the end. I say the pain went away after maybe 2-3 weeks. I would say maybe about a month of treatment. The pain subsided. It was still there, but not as much pain. The intensity wasn't there anymore. It lowered itself. So I was able to get around a little bit more. I had more mobility. So yeah, I was so happy, so happy. My mobility now after being treated by Dr. Utley is remarkable. I'm able to get around without pain. I don't walk with the awkward walk anymore. I'm able to get around now because I'm a season ticket holder for the Falcons, as you can see. So walking, from the stadium and back home or to a train station or wherever, it was very important for me because so that mobility is back, and I'm at 100% now, and I thank Dr. Utley for that. I would recommend Dr. Utley to anybody who has back pain or suffer with any kind of pain dealing with your legs, your arms, your back, your neck, because it's pretty much it's all one, and it starts with your back. So yeah, Dr. Utley, he gets 2 thumbs up for me, and I'm pretty sure the other people who have been treated by him can tell you the same thing. So yeah, Dr. Utley, I would recommend him. I believe he's done professional athletes, if I'm not mistaken. I seen him around with Dominique Wilkins, and I know I'm name dropping, but I'm not sure if Dominique had been into the office, but I seen him around with Dominique Wilkins a lot, so I don't know. I'm just putting it out there. But yes, I would give people recommendations to see Dr. Utley. Even if you don't have any pain in your back, just to have regular treatments, just like you're going to get a regular checkup for your doctor, or have your physical. I would suggest to go see a chiropractor. It may not be Dr. Utley, but go see a chiropractor.